to you about COVID-19, also known as the coronavirus, and then he's going to come out and talk to you guys about your family member. Okay. All right, so the coronavirus is a respiratory illness that has rapidly spread from person to person. This has caused the pandemic that we are currently living in. Sources has also reported that this virus originally started in China. So how it is spread is a lot like the common cold and the flu, where we have come in contact with an infected person and inhaled droplets into our lungs from someone who's either coughed or sneezed, or also if the droplet has landed on a surface, and you know how periodically, unconsciously, sometimes we'll touch our face, our nose, and our mouth, and it can get inhaled that way as well. Some of the signs and symptoms are cough, fatigue, shortness of breath, muscle or body aches, fever, headache, runny nose, congestion, new loss or smell, sore throat, diarrhea. The symptoms can appear anywhere from 2 to 14 days after coming in contact with the virus. But over 80% of the cases so far have been mild. The diagnosis is we do self-assessment of some of the symptoms, like they'll ask if you're sick, you have a fever, coughing, headaches, difficulty breathing, and know then when to call the doctor. When you do contact the doctor, or if you have to go into the doctor, they're going to ask you some of the same questions, and also ask you if you have recently traveled to an area that has an increase of ongoing cases. And then if warranted, then you would be asked to do COVID testing. Currently, there's no vaccine, but this can change in the near future. Antibiotics do not work for this virus. However, people with COVID have been getting bacterial infections, which they have been prescribed antibiotics. There have been some meds that have been used to treat this, but that have been somewhat helpful in battling this virus, along with the protocols that have been suggested by the CDC and other health experts for the continuous spread of this disease. Also, we need to continue to practice social distancing of the 6 feet and maintain proper hand and body hygiene. For severe cases, we are using the same treatments we use for patients who are in acute respiratory distress. So the doctor will be out here with any further questions. I thank you for your time right now.